Exploring runner's knee, unveiling the latest in identification, prevention, and treatment. What exactly is runner's knee? Patellofemoral pain syndrome. So, let's dive right in. Runner's knee, scientifically known as patellofemoral pain syndrome, or PFPS, is a pretty common issue that causes pain right at the front of your knee or around your kneecap. Specifically, it affects the spot where your kneecap meets your thigh bone. Now, this isn't just one thing. It's actually a broad term that covers pain from the patellofemoral joint or the soft tissues around it. And here's the kicker. This pain usually creeps up on you, gradually getting worse over time. It's not just runners who get this. In fact, PFPS is one of the most common overuse injuries in active adults. Just how common? Well, studies show it affects anywhere from 19 to 30% of female runners and 13 to 25% of male runners. That's a lot of folks, which is why knowing the signs, how to prevent it, and how to treat it is super important. How do you know if you have runner's knee? The signs and symptoms. The most telltale sign of runner's knee? Pain right at the front, back, or around your kneecap. And it's often tricky to pinpoint the exact spot. People usually just point to a general area around the front of the knee. The pain itself? It can range from a dull ache to something really sharp and intense. This pain typically gets worse when your knee is under load, like when you're running, jumping, squatting, or climbing stairs. Even sitting for a long time with your knees bent can do it. The pain might ease up when you rest, but it'll be back as soon as you start moving again. It can hit one or both knees, and sometimes the pain can even spread to the back of your knee. And here's a weird one, the theater sign. That's when your knee hurts more after sitting for ages with your knees bent, like at the movies or on a long drive. You might also hear grinding, clicking, or popping when you bend or straighten your knee. Your knee might feel stiff or sore after sitting for a while too. In some cases, there might be a bit of swelling around your kneecap, and you could feel some weakness or instability in the knee. Basically, the symptoms of runner's knee can be quite varied and differ from person to person. Knowing what triggers your pain, like strenuous activity or prolonged sitting, and where the pain is located is key to getting a diagnosis. And remember, knee noises aren't always a red flag, especially if they're not painful. Let's stop it before it starts. Preventing runner's knee. All right, let's talk about prevention. The main goal here is to reduce stress on your patellofemoral joint and make your knee more stable. First up, strengthening exercises. Strong quadriceps muscles help keep your kneecap in place and moving properly in the femoral groove. Good exercises for this include straight leg raises, wall sits, leg extensions, and squats. It's vital to strengthen your whole quadriceps, including the vastus medialis and vastus lateralis, to keep things balanced. Your hip muscles are also super important for controlling knee movement. Weak hip muscles can cause your knees to collapse inwards when you run, putting extra stress on that patellofemoral joint. Try exercises like lateral leg raises, clamshells, and glute bridges to improve hip and knee stability. So, bottom line, strong quads and hips are key. Next, how you run matters. Adjusting your stride length, shortening it, can help reduce the impact on your knee. Increasing your step frequency, aiming for around 170-180 steps per minute, also helps. Try to land on your midfoot rather than your heel to spread the force more evenly. And keep your posture upright when you run. If you have biomechanical issues like knee valgus, gait retraining can help. Choosing the right footwear is also a big deal. Good running shoes with proper cushioning and arch support are essential. Replace them every 300 to 500 miles or when they show signs of wear. Orthotics can correct foot and lower leg misalignment, especially if you have flat feet. Knee braces can support your knee during activity like recovery or high-impact workouts, but don't rely on them long-term. Patellar taping can also help reduce pain and improve kneecap alignment in the short term. Always warm up properly before exercise and cool down afterward. This prepares your muscles and helps them recover, reducing soreness and stiffness. And finally, gradually increase your training intensity and volume. Avoid doing too much too soon, especially when running. The 10% per week rule is a good guideline, and always listen to your body and adjust your training if you feel pain or discomfort. Your action plan, preventing and treating runner's knee. Let's walk through some recommended exercises for both preventing and treating runner's knee. First, we have straight leg raises. These target your quadriceps and core muscles, and they're designed to strengthen them. Remember to perform these slowly and with control. Next, clamshell exercises. These focus on your hip muscles, specifically the gluteus medius and maximus. They help strengthen your hips and improve pelvic and knee stability. Keep your feet together throughout this exercise. Then, lateral leg raises. Again, these target your hip muscles, particularly the gluteus medius, and they're also for strengthening your hips and improving stability. Keep your legs straight as you lift it. Glute bridges are next. These work your gluteus maximus, strengthening it and improving pelvic and knee stability. Be sure to squeeze your glutes when you lift your hips. Moving on to wall sits. These strengthen your quadriceps. Make sure to keep your knees behind your toes. Squats are a great all-rounder, strengthening your quadriceps, glutes, and hamstrings. Keep your knees behind your toes and your back straight. Step-ups strengthen your quadriceps and glutes during functional movement. Choose a step height that's appropriate for you. Step-downs improve control and muscle strength during functional movement. Perform these slowly and with control. For flexibility, we have the quadriceps stretch. This improves quadriceps flexibility. Hold the stretch for 15 to 30 seconds and you should feel it at the front of your thigh. Then the hamstring stretch. This improves hamstring flexibility. Hold this stretch for about 30 seconds, feeling it at the back of your thigh. Calf stretches are also important. We have two types, one for the gastrocnemius with a straight knee, and one for the soleus with a slightly bent knee. Hold each position for about 30 seconds. Finally, single leg balance. This improves balance and muscle control. You can increase the difficulty by standing on an unstable surface like a cushion. Let's fix it. Current treatment methods for runner's knee. Now, if you already have runner's knee, what then? Treatment usually starts with conservative methods to reduce pain, inflammation, and get your knee working again. Rest and activity modification are key. Cut back on or stop activities that cause pain until it subsides. Try low-impact activities like swimming or cycling to stay fit without stressing your knee further. Ice and compression are your friends. Apply ice to your knee for 15-20 minutes, several times a day, to reduce pain and swelling. Gently wrap your knee with an elastic bandage for support. Physical therapy is crucial. Exercises will focus on strengthening the muscles around your knee, especially your quads and hips, to improve stability and function. Stretching will improve flexibility, and exercises to improve your movement and biomechanics like gait retraining can also help. Physical therapy might also include techniques like soft tissue massage and joint mobilization. Knee braces and other supportive devices can be beneficial. Knee braces can help support your kneecap, while orthotics can improve leg alignment. Patellar taping is also a common short-term fix. Over-the-counter pain relievers like ibuprofen can help with pain and inflammation, but use them sparingly. In some cases, corticosteroid injections might be considered, but they're not a long-term solution. Recent research also suggests that self-management programs that combine exercise, mindfulness, and education can be helpful. Surgery is rarely needed for runner's knee. It's usually only an option if other treatments fail, and even then, only after at least 2 years. Runner's knee. What you need to know. An overview. In a nutshell, runner's knee, PFPS, is a common issue that causes pain in the front of your knee, especially if you're active. The main signs are pain around your kneecap that worsens with load-bearing or prolonged sitting and might be accompanied by grinding or other noises in your knee. Preventing it involves strengthening your quads and hips, using proper running technique, choosing the right footwear, using supportive devices, warming up and cooling down properly, and gradually increasing your training intensity. Treatment is usually conservative. Rest, ice, physical therapy, knee braces, and short-term pain relievers. Surgery is a last resort. The latest research emphasizes the importance of physical therapy, especially exercises that strengthen your hips and quads. Self-management programs with education and mindfulness are also promising. And while conservative treatments are often effective, a personalized treatment plan is essential. Research is ongoing to find the best ways to prevent and treat this condition.